multidisciplinary approach to facilitate learning in specific learning disability and practices in different parts of the world. This session's keynote speaker, Mr. Praveen, will share with us the procedure, techniques, and strategies used in UAE while working with specific learning disability. He has more than 15 years of experience as a psychologist and intervention specialist. He has been conducting psychoeducational assessments and continues to successfully rehabilitate children with learning differences using multidisciplinary approach to facilitate positive changes in children with special needs. It gives me immense pleasure to introduce Mr. Praveen. He has a very diverse profile. He has been continuously upgrading himself with new techniques and strategies that benefits children with specific learning disability. He is not only an expert qualified assessor, but he's also trained in strategic intervention model from University of Kansas. He's proficient in instrumental enrichment program, which is used internationally to enhance metacognitive skills. He has completed this program for International Center for Enhancement of Learning Potential. He has completed level 1 and level 2 of Slingerland Multisensory Teaching Approach from Wilson Academy. I would request Mr. Praveen to share with us his knowledge and experience in the practices used for assessment and diagnosis in UAE. Dear audience, please welcome Mr. Praveen, our speaker for assessment and diagnosis practices for SLD in UAE. Over to you, Mr. Praveen.
Thank you, Ms. Shiba. Thank you all. I think I'm audible to you all.
Yes.
Yes, thank you. Okay, so it's good afternoon from here, Dubai. It's 1 o'clock here, and it should be 2:30 there, right?
Yes,
Yeah.
yes.
Okay. So I would like to, start with a video. I'm going to share that from YouTube. This is from one of my students, long back. She just made a video on the importance of education in the UAE. She's from UAE, yeah? So I'm just going to share that first. Yeah, can you see that?
Yes.
Yeah.
Education is one of the most significant pillars that the United Arab Emirates depends on, and it's the fundamental of society and humanity building. Back to 60 years ago, in the early 50s, the education started in the UAE where there were no schools because the country's money lack simplicity, and parents were not aware of the education importance for their children, especially for the ladies. The education in the UAE began when the children who aged from 5 to 8 years were going to the mosques or al-mutawwa house morning, as there were small areas specified for them.
Yeah, of the kid there. So she actually was one of my students, and she was getting intervention through us, and now she's doing well in her life. Okay, so here I would like to share my presentation. You can see that, right?
Yes, yes.
Yeah, great. Okay, so I would like to start with my first one. So that is history of special education in the United Arab Emirates. Yeah. So it actually started from 1979. United Arab Emirates, UAE, actually involved in all these special education area, and it expanded to recognize wider categories of special education. Before, it was mainly focusing on the education, like educating all, like we can say, like education now, like it was not given to girls, and in 1979 on, so they made a rule that it should be given to all students. And you can see the categories of special education is available for all grades, higher grades, to promote inclusive education. Then the latest amendment in the rule actually happened in 2006. In the special education programs and services in the UAE were expanded to include the delivery of services students up to 9th grade. Yeah, so normally here it was just given until 5, and here It went up to 9th grade. So now the Federal Law 29 in 2006 regarding, so this is the term they use, the rights of persons with special needs. So that's the term they use for it in the law, that promote the philosophy of inclusive education. So there only, from 2006 only, they found the importance, yeah, and they added the term inclusive education, yeah, in the system of education. And the education institutes in the UAE then have access to equal education opportunities to all. Now, no students are, like given away, like they can just give opportunities to be in the mainstream school and with proper support from the school. Yeah. Now, the definition of dyslexia in the UAE. So you can just see this definition is almost, in par with the one that we have of International Dyslexia Association. Now, I will just read it to you first, and you can just see only some parts of it, like psychological aspects they have added there. And a specific learning disability means a disorder in one or more of the basic psychological processes. That's an addition they have added there, involved in understanding or in using language spoken and written. That is also not there in the International Dyslexia Association's definition. So this is language spoken or written that may manifest itself in the imperfect ability to listen, think, speak, read, write, spell, or perform mathematical calculations and or mathematical reasoning, including conditions such as perceptual disabilities, brain injury, minimal brain dysfunction, dyslexia, or developmental aphasia. So this is the one that they made based on, actually you can just see that the population here is like multicultural, people from different parts of the world, and their expectations are different. So they had to add all those parts in there. And now you can see the second one, this term does not include learning problems that are primarily the result of visual, hearing, or motor abilities, of cognitive disability, of emotional disability, or of environmental, cultural, or economic disadvantage. Yeah, so this is going almost as far with the normal, the basic definition of International Dyslexia Association. Now, we are going into the pre-referral services. Actually, once the student is identified, I will just go into the assessment and all the other processes after. I just want to tell you this one, how the referral services work. So before a referral is made, they have to determine the eligibility for special education programs, because it should be coming from a multidisciplinary team. It's not just like one person refer and go to psychologist, do an assessment, and get your special education services. No. You have to do all the assessments and get the report, and you need to get the permission from the ministry, the approval from the ministry, to get the support of multidisciplinary group for special education programs. So you can see here, before a referral is made to determine the student's eligibility for special education programs and services, students enrolled in regular education classrooms, then they will be observed in the classroom, whose performance does not meet expectations compared to their peers, should be referred to the school support team. Yeah, that will have the principal, I'm going to talk about that later, principal, then the class teacher, the psychologist, counselor, whoever it is, they have a team, then who will develop an intervention plan after the assessment report is out. Yeah. There we go. So now the procedures for identification of learning difficulties in the schools. So when a student who is not enrolled in any special education program, and he's, if the teacher is observing any type of learning difficulties or behavior difficulties, the school, the person, whoever it is, will be referred to a community organization, in the sense like they will be referred outside for an assessment. Yeah, a comprehensive evaluation will be done for her or his eligibility for the special education programs and services. Okay, so sorry, if you have any questions in between, you can stop me in between. Yeah, so shall I go ahead?
Yeah, I guess so, because the participants are muted, so they will not be able to talk, but they're
No.
putting their questions in the chat box. Somebody
Okay.
is looking at it, and at the end, you will be presented with the questions.
So, thank you. Yeah. Okay, so now you can just see the steps involved in the whole process, starting from the evaluation until the end of getting the certificate after the completion of special education program. So the first one is pre-referral from student or student support team in school or the parent. Then second, the referral or evaluation, or we need to see the eligibility, whether the student is eligible or what type of program should be given to the student. That will be decided here in the second one. In the third one, this same team will prepare an IEP. Yeah, and then for the gifted student, this is ALP, that is called Advanced Learning Program. So that is for the gifted students. Then they will implement IEP or ALP. Now in the fifth one, they always have a review assessment to see the progress. So these review assessments will be done by the same team, and they will analyze and see that, okay, how the IEP or the ALP has worked. And at the end, they will have a certificate. After the completion of school, they will get a completion certificate for their course completion. Yeah. Now, step one in pre-referral, that is the student support teams. The school principal forms is a responsibility of the school principal to form the school support team, and the principal will decide who should be involved in the team. And you can see normally it consists of the principal, student's teacher, a special education teacher, then the social worker, speech and language pathologist, and psychologist. The student who is experiencing learning problems, the parent also invited in to participate in the meetings, because they will conduct regular meetings until the report is ready for the first time. Yeah, after that, the evaluation will be done, and then they decide on the IEP or ALP. It will go step by step like that. Then the second one will be written referrals to the SSC will be made by the school personnel, and the school principal or the person authorized should attest that for the assessment. Step two, now we are going to the referral evaluation and eligibility determination. So then after the school, they will make a multidisciplinary evaluation team. Okay, the members who conduct the evaluation include special education teacher, that's the starting, then the teacher, then we will normally give out some forms for their behavior at home. So the guardian also involved in that one. Then the school principal, psychologist, social worker, and other specialists who are required according to the condition of the students, such as speech therapist or physical therapist, in the sense like OT or psychotherapist or whoever it is. Yeah. So any therapist who needs it to be involved, it will be involved, and each one should give a report on the condition, and that all will be analyzed by the ministry. Yeah, to decide on the eligibility of the special education. Now, each member of the MET conducts a comprehensive assessment to determine the student's strengths, needs, and present level of academic and social function. Then the multi-evaluation team, this is a rule that is from the amendment I showed you before. This is a rule that that's mandatory, that they must meet or complete the evaluation within 30 days from the referral. Yeah, and they have to, each one of them who is involved should be given a report on the particular child, and then it will be forwarded to the principal, and the principal will be forwarding that to the ministry. Then here we have here a department called Special Education Needs and Disabilities Department, SEND, in UAE schools. Yeah, this department is the one who is responsible for the referrals. Principal will decide on who are there in the team, and the person for the referral or early identification will be the person from the Special Education Needs and Disabilities Department, SEND. So a child or a young person has SEND, special education needs. If they have learning difficulty or disability, which calls for special education provision to be made for them. A child of compulsory school age, that starts from age minimum 3, or a young person has a learning difficulty or disability, this is the criteria. If they have significant or greater difficulty in learning, like when you compare to the age, when we compare from the age group, okay, this is depending on the age group, than the majority of others of the same age, or have a disability which prevents or hinders them from making use of educational facilities of a kind generally provided for others of the same age in mainstream schools or mainstream post-16 institutions. So each child should be given an opportunity to get into the normal mainstream school. From there only, they decide on the type of difficulty and what type of special education or the support should be given. Yeah, now normally the assessment tools used for the SLD are, like this is the one that I use. And I'm just going to show you here. This is a sample report that we make. And you can see this is the organization of the report. Always, this should be the case for the ministry because it should follow the same sequence. And you can see purpose of evaluation should be there, the assessment instruments used, then summary of the assessment, diagnosis, recommendation, accommodations for school, then instructional recommendations, assessment results, and all technical, the scores. So it should be there at the end because all these will be analyzed by another one in the ministry. So it should be the same. So then you can just see that it starts from here and going on like that one. Yeah. Then the authority who is responsible for, observing or checking these ones in school, that is called Knowledge and Human Development Authority. We call it as KHDA. That is coming under the Ministry of Education here. Here we can just see in the UAE, the ministry is divided actually into two. The Ministry of Education actually divided into two. Okay, it's normal, the Ministry of Education and Ministry of Higher Education, then they are in two different, they have two different functions. And this KHDA comes under Ministry of Education. So KHDAs, actually, they have a policy. They are the ones who are making the policies for the schools. And based on the policies, they have a system of observing the schools. Each year, they come to schools and observe the schools, their performance, normal for the subjects, and then for SEND also. And they will be given a ranking. So this ranking will be based on how they perform, including the SEND, yeah, special education needs. And then only, for the schools who are getting maximum grades, like for, we can say outstanding, they are allowed to, revise their fees, or, they can get grants from the government and things like that. And those who are coming under, we can just say weak, they will get 2 more chances to they can move to the next categories. And if they are not, and they will be given 2 chances, and then they have to shut down. So that is the case in here, okay? So now the KHDA's new policy means schools will be required to provide a minimum level of SEND provision, that is Special Education Needs Department, without raising any fees, no extra fees. They will also not be allowed to turn children away. They can't say no to any student who has any of the problems, okay? I'm just saying special, help they need, but the school can't say no to anyone. They should include all the students in the school. Then from there, we have, all the facilities of the departments to identify what is the exact problem and then give support. Now, in more serious cases requiring additional support, schools may not profit from this. That means they have to give it for free. Now, this is the latest step underlining the focus in the past 2 years of the provision of SEND in mainstream schools and the introduction of separate ratings in relation to SEND provisions. That means, like, Before, they didn't have this provision. Now they added the special education needs department also in the rating system in observation. And based on that only, they will be getting the rankings. Yeah, all the schools get the rankings. The measures, these measures have started to show results in terms of identification of those schools that show a real commitment to supporting students of determination. Now, these are the ratings by KHDA. First one is outstanding, then exceptionally high quality of performance or practice. Second one is very good. The quality of performance exceeds. Next one is good. The expected level of quality for every school, that is the normal, we call it as average. Next one is acceptable. That means the minimum level of acceptability required. Then weak, that's the one that I was talking about. Weak quality, not yet at the level of acceptable range. Okay, now coming to the licensing authority for the professionals. This, you may be interested in that one. So whoever is interested to work in the UAE, you need to know this one, because this is the authority who license, like the Rehabilitation Council of India. So this is the authority who license the professionals here in the UAE. You can see that is called Community Development Authority, CDA. Any professional who wishes to provide social care services within the Emirate of Dubai, this is mainly for Dubai, CDA, but now they're expanding to other Emirates, has to apply for this service. The professionals include social worker, social counselor, social therapist, you can just say the behavior analyst, assistant behavior analyst, psychologist, assistant psychologist, then special education teacher or learning support teacher should get license from the CDA. The process is actually long in the sense like, for example, if, I had my certificates from different countries and, all those certificates should be equalized here in the UAE. And then what you need to do is you need to get the transcription of your marks from, like, for example, if you have done your graduation or post-graduation, then you need to get, if you think that is a post-graduation one, you need to get the transcription of marks for the post-graduation, then graduation, and from the, higher secondary school. So it should be starting from that stage. And then you need to get that attestation, done by the government of India, then done by the government of UAE. Then you need to submit for equalization. After that only you can just go for the license. And even after you get all these things done, you will have to attend a test and an interview to get your license. So this is a step-by-step process, it takes time. Then the license issued is for 2 years validity and is renewable. And in the sense like you need to attend, like same as the RCI, you need to attend seminars like minimum 6 for a year, and then it will be automatically renewed. Okay, now you can just see that special education programs, this is the pyramid coming from directly from the Ministry of Education. So it is like based on how it is given for each student based on their needs. Yeah, and you can just see that from the very basics to the top here. The very basic one is here for the regular education classroom. It's this all like starting from the school. You can see that community-based services and homebound services or hospitals or the centers, then the school-based services. So you can see here in the pyramid, the first one is regular. I will be just talking a bit more about that one in the coming slides, okay? So I'm just going to name them and we'll talk more about that in the coming slides. You can see that the regular education classroom, that is the first one, that is a community-based special education support. Then here, regular education classroom, that is in school, regular education classroom based special education support in school. Then regular education classroom, school-based special education support. Then regular education and special education classroom in the school. Then special education full-time classroom or center-based education fully, like we can say, for example, IIOC, yeah, open schooling. So we can see that that is the one last that they are getting fully separate special schools. Yeah. Now, there we go. That's one, sorry, here. I need to move my video a little bit. Okay. So you can just see that here, this is the inclusion part. So now coming from assessment, identification, inclusion. So always you can just see that we start from the very basic steps of how to be identified and how these students are assessed. And based on the eligibility criteria, they include, like, inclusive education is a must here. So we have to include all the students. They need to get the opportunity to learn in the normal school setting, and if at all they can't, then only we will let them go to a special education school. So this is about the inclusive education in school. So the first one includes inclusion in regular education classroom with community-based support. So students with special needs may be enrolled in a regular education classroom and receive special education support services from community providers. That means they will be going to school, and after school, they will be getting support of a psychologist or a special educator or an intervention specialist, whoever is needed. Yeah, that is the first one. Second one, inclusion in regular education classroom with classroom-based support. In here, students with special needs may be enrolled in a regular education classroom and receive special education support services in the classroom from the general or special educated teachers or from specialists. For example, students with a speech and language disability may receive speech therapy services from the speech and language therapist in the regular education classroom while the student is there in the classroom. Here is a role of a learning support assistant comes. We call LSAs. Learning support assistants will be there in every school. So each student who are in need of support in class, okay? For example, the teacher is explaining something with a student with, processing speed is low, just as an example. This learning support assistant will take that student to a corner of that classroom, and she will be, or he will be, giving special instructions for that student in the classroom to cope up with what is happening in the class. Then third one, inclusion in regular education classroom with school-based support. So students with special needs may be enrolled in a regular education classroom and receive special education programs and services outside of the regular classroom. But in the school setting, it should be in the school setting, yeah? For example, a student with a specific learning disability might receive individualized instruction from a reading specialist in the school setting, but outside of the regular education classroom. In the sense, I've been to many schools here for observations and for instructions, for assessments, yeah? So I've done, the same one that you can see, the third one, with all curriculums like CBSE, ICAC, IB, English curriculum, American curriculum, So this one, we will take the student, actually we'll pull the student out of the regular classroom. For students, we call it as exemptions, language exemptions. Here, we can apply for language exemptions for students. For example, learning Arabic is a must for all the students here in the UAE. And what they have to do is, if the student's processing speed is low, and then they see that it's the student dyslexic, and dyslexic in the sense like, okay, if the student is having like not minor, moderate or major, then they're eligible for Arabic exemption. Yeah, so that time will be used to pull up these students for the special support. So these exemptions are allowed, but that is also based on the ministry's decision. Yeah. Then the fourth one is inclusion in regular education classroom with resource room support. A resource room is a classroom located in the regular education school where students with special needs or the gifted and talented may attend to receive individual or group instruction and support in not more than half of his academic subjects, as indicated in the IEPs or ALP. I told about that IEP and ALP. And here, this one is normally it's a decision of the inclusion team in the school. Whether they need to just take that student is based on, again, the level of the students. They will decide whether the student should be in a resource room support. And if it's in resource room support, half of the subjects, they will get help as a special, separate tutoring. And half of the time they will be in their regular classroom. Then you can just see their basic special education classroom. So the basic education classroom is a classroom in a regular education school, normal school, where students with special needs attend to receive group instruction and support in the majority of the academic subjects as indicated in the IEP. And you can just see the difference between a resource room and a basic special education classroom. That is actually happening in school, yeah? And in a resource room, you can see that the student will be getting help only for few subjects based on the need. But here in a basic special education classrooms, you can just see the students they need help, like think that, okay, severe dyslexic will get full support in school for all the subjects. They will be going to their regular classrooms only for like the periods like PE, physical education, or computer, or just like some social activities like that one. Otherwise, they will be in a basic special education classroom. Then the community-based education programs. Community-based education programs may be provided to students outside of the regular education school setting due to factors which prevent them from attending school. This is the special school that we are talking about. Yeah, or here we are thinking about the NIOS program, or whichever it is, it's not the NIOS, I'm just giving as an example. Okay, in such case, a medical report which is recognized by official authorities, the ministry, such as government hospitals, must be provided. Similarly, the concerned authorities and teachers must be mentioned to provide the student with the services in the individual education plan. In the UAE here, IEP or ALP, it's a must, and that also should be given to the students. That is, that is a must actually. That should be also recognized or attested by the ministry. IEP, we can't just make any IEP and just work on it. No, there should be measurable goals, and it should be measured. The progress should be measured, and it should be carried on like that one. That's a must here. IEP and the ALP should be attested by the ministry, and it should be given the permission from the school by the principal. It should be carried on like that. It's a step-by-step process. All these things goes under the ministry's umbrella. Yeah. So there we go. Now we are coming to the accommodations. Okay, so when we are coming to the accommodations of the school, yeah, is all accommodations are based on the results of the assessment and the agreed IEP or ALP. Yeah, so the strategies, I'm just going to show you some, some of the practices that we use here in the UAE in different schools. Yeah, I was actually, before going into that, I would like to just share something. I just went for a school observation today. It's about a child, okay? So she was in Pakistan doing online lessons for all these 2 years. And she did an assessment with me, and she's a bright one. And the processing speed actually comes in the low average range. And the school is concerned, and school was suspecting that she is coming under not dyslexic category, coming under the spectrum, autistic spectrum category. So when I went to school, and they were concerned about her, social behavior, how she adjusts with the students, and they are very concerned about that. And yeah, today I went for an observation, for one in classroom and one in the playground. So what I've seen is, since the processing speed actually is very low, what happened is this child is not getting instructions fast enough. Yeah, and once that the teacher is giving instructions, she is trying to take time to process this information and takes time for her to process that. And by the meantime, she's getting the next one and the next one and the next one. She's lost and she behaves like she's blank. She didn't understand anything. And when I compared the child in the classroom to the playground, that's a totally different child. You know, she was responsibly acting in the playground, and she was talking to the friends, and you know, she was having fun. So that is the thing, you know, these accommodations, like all the teachers actually call us for observations, and that makes a huge difference, you know, from the assessment results. Actually, I can just see that, okay, we do assessments, okay, that is a controlled environment anyways. So we do assessments, we see the child, we observe the child in that environment, that is controlled. But when we see the students in school while they are behaving normally, and we can see the big difference, actually. Yeah, so now I'm going to the accommodations here. The first one here, strategies and methods of assessment used with students who have a specific learning disability must be developed based on the needs of the students as specified in the IEP. Again, IEP is a document that whoever is making the IEP is responsible for answering for the improvement or why no improvement and the reasons. Yeah, so it should be going in tune with the IEP, whatever accommodations that you are giving. Then in the event that a student has a problem in reading the questions, the test times must be, the test items must be read to him to make sure he understands the contents before answering the questions in all subjects. So that is for mainly for the dyslexic with the reading problems. And again, it should be, you know, there is a cutoff category, yeah, in the assessment results. It should be moderate to to severe. Okay, moderate to severe. Then only you will get that help of a reader to read the questions to the students. Then the third one, if the student has difficulty in writing, he must be assessed orally, or the answers should be written for him, scribe, or recorded on tape as required in the interest of the student. The student can decide here whether he needs a scribe or someone should record the student's answers. Yeah, that is the decision of the student. Then if there is a problem in the student's attention span, the students must be assessed in a location that is free from distraction. So again, that is like pull out from the classrooms, and the students should be given not in a group, should be given individual assessments in a separate room. Then the students will be given breaks during the assessment according to the ability of focus to continue and perform the task. So as with short attention span, we have to give the task or the assessment in smaller chunks. Then if the student is hyperactive, in addition to the learning difficulties, he should be allowed to get up from the seat and walk and then sit again during the assessment. That is allowed. Yeah. And then if a student has memory deficits, the material must be presented in smaller amounts. All these things should be prepared beforehand for the assessment. That is a responsibility of the inclusion team, or we call it a SEND, Special Education Need Coordinator. Then the special education teacher or resource room teacher will undertake supervision of the assessment test of the students in the subject or in which they receive special education services, only for those. That is for the categories I told you, that comes on top. Only like if they are getting support for 1 or 2 subjects, they will get support or the supervision only for those subjects, not for all assessments. Then the student is not assessed in more than 1 subject in 1 day. That is a rule here, giving him adequate time to answer the test questions depending on the needs of the student. Now, the special education teacher or resource room teacher will undertake the task of supervising the assessments of the students in the subject for which they receive special education service. Yep, I think Shukran, that's actually thank you from here. So I think I can take some questions now. These are the very basic, systems here in the UAE based on the assessment, the practices of assessment, the practices for, referrals and inclusion, and even the licensing, everything. So now I think I'm ready for some questions if you want to ask me.
Ma'am, may I go ahead?
Yes. Yes, please.
Yes. Thank you so much, Mr. Praveen A V, for the informative, knowledgeable, and wonderful session. May I now invite Dr. Gayatri Sirur, Associate Professor, Hashwadwani College of Special Education, for the question and answer session. Thank you. Over to you, Dr. Sirur.
Thank you, Ms. Kavita Salvi. Sir, you have created so many questions in our participants' mind, and it's bombarded in the chat box.
Sorry for that.
So, no, not at all. That means the session was really wonderful. So, and informative.
Sorry to cut you. One thing I needed to tell you here, I just didn't want to just give all these things and, just give that information. It will not work. That's why I thought, okay, I will just cut short a little bit and I will ask more questions, just take more questions.
Okay, so I start with the first one. At what age the student eligibility is decided?
As I said, when the student going to school, like we can say 3, from that time we start our observation. Then they decide actually 4 is the minimum age for referral.
Okay. Does every school has all the various kinds of professionals, or does government send them like they are rolling like our SSA teachers?
Okay, so they have a department here in all the schools, inclusive department, yeah, and they call it a SEND also, as I said, Special Education Needs Department. In the department, there is a psychologist, yeah, then there is a speech pathologist, then the expert services, yeah, special educators is also there, and the expert services are to be asked from outside. Yeah, counselors will be there, but the psychologists of different, like if you need a school psychologist, if you need a clinical psychologist, so whoever it is, they need to ask for help from outside centers. They will come, they will assess, and they are part of the team.
Okay. What is the difference between special ed teacher and learning support teacher? Is the learning support teacher similar to a shadow teacher who works with individual child?
Shadow teachers, actually, I will not say they are same as the LSAs, so learning support assistant. Actually, learning support assistants are special educators. Yeah, shadow teachers are there, they are just tutors. Yeah, they are not trained in any special education. They are just tutors to help the student in the class to understand what is happening in the class.
Okay. So obviously the school is paying LSAs. That's the next question.
Sorry.
That who?
No, it should be the parent. It should be the parent who has to, take that even for the shadow teachers and shadow teachers. I'm talking about the shadow teachers. For the LSA, for whoever is there in the SEND department, it's a school paying. Only for the shadow, it will be the parents.
Okay. So what is the composition of a typical SEND in a school?
Okay. So a typical SEND will have, that's what I just said before. There will be a head of the department. Yeah, that will be either a psychologist or a special educator, doesn't matter. So there will be head of the department, and based on the students' strength, there will be number of special educators or LSAs. And then the third one will be psychologists and counselors. And there will be always a nurse in the school if we need any medical reference. So that is the team.
Okay. Can the language exemption be obtained if the child is at risk but not yet diagnosed?
After the diagnosis. Only after the diagnosis, the ministry should approve that, and then only they are allowed to get the language exemption.
Okay. Sir, is there any link which you can tell us where they can download or see your IEP formats?
My IEP formats, actually, the IEP formats, the sense is pure confidential. You know, it's for a particular child, and the government is not permitting anyone, you know, other than the team, you know, to get it shared.
So to offer ALP, a school would have to be equipped with specific mentors to support the G&T.
Yes.
What role can a special educator play in building the ALP?
Yes, gifted and talented students, actually, you know, it's very difficult to manage them in schools, you know, because they get bored very easily with each and everything. Oh, it's boring, it's boring, it's boring, because I've seen that a lot of times. Making them, you know, giving them more challenging tasks is the main thing, you know. All these people or whoever is responsible in the team, okay, are equipped in the sense, and they will get trained to manage these students, and it's all based on you know, the demand of the school. If you have a student or students with gifted, talented, and the personals will be trained, and they will assign equal number of times to be seen, and they will be giving more responsibility to be with them and give them more challenging tasks.
Whatever accommodations are provided, are they board specific, or they are given in a particular state?
Yeah, it's actually all the, I told you that all the systems here, American or IB or, you know, British, Indian, CBSE, ICSE, accommodations are based on the needs of the student. You know, all the students will not get extra time. All the students will not get ascribed, you know. So it's all based on the, you know, what they need, on the needs of the student. And we have a number of them, like around 15 of them. And based on the need of the student, we provide that.
What kind of formal assessments are used for assessment of SLD there?
I think I've shown you there.
Yes, that slide was.
Can you please share the, you know, I can just show you this one here one more time. Please give me a second. If you want to take a screenshot, please take a screenshot of it. These are the ones.
So what is the ratio of inclusive schools compared to special schools?
You know, inclusive schools in the sense like we have like normal schools, yeah. The ratio in the sense like we have inclusive school, like inclusion department in all the schools. So obviously the mainstream schools are more than the special schools. And only thing is, you know, when you compare the population between India and UAE, UAE is very less. So the special schools are less in the sense, but every one student is getting that support, whoever needed it. No one is opted out.
Okay. What is the gap between the first assessment and the second one?
Like normally we say internationally accepted 6 months.
Okay. At what age usually the formal assessment is done?
That's what, like after 4.
Okay. Okay, I think there are too many questions. I'll take one more here, more relevant to our topic. Sir, give me one sec.
Yeah, sure.
If there is any school which doesn't support special needs children, then what steps are taken?
Sorry, can you please repeat the question?
If at all there is any school which is not able to or doesn't support children with special needs, what steps are taken?
I will just share my slide one more time. 1 second. You can see the rankings. Okay, if a school is coming under the weak category, that is also including the special needs. If coming under the weak category, they will be given 2 chances. Sorry to tell you that it will be they will be closed.
Okay. how to go about with assessment when the attention span of the student is really very, very poor?
Okay, always in the assessment, normally we see assessment students like normal average time, like 2 sessions, 1.5 hours. But for these students, we will just span it into different days. Yeah, like maximum like half an hour, 45 minutes, give them break 15 minutes, 15 minutes, 15 minutes, and we do like that. And we will not keep the student for longer time who are having attention issues. And we take that time. I know it will be done over 1 week. The maximum is 1 week.
Okay, so this is the last one. What kind of scores do you see for LD kids when it comes to GAI versus CPI on an IQ test?
Okay, when you see the comparison of the assessments, you can just see like we always see what is the gap between their IQ or what is their cognitive level and what is their ability level. When we see, okay, a gifted student, maybe like he will be in the superior range and then his achievement will be just in the average range, but still that is a gap. Yeah, and we always see the gap. So always, most of the time with dyslexic students, the pattern what we see is, okay, the cognitive level of the student will be high and the ability, the achievement, what they are doing for, academics will be lower. So that is the gap that we always see.
Thank you, sir. I think you have very patiently and elaborately answered all queries of our participants. Over to Kavita Salvi now.
Thank you, Dr. Sirur. Thank you, Praveen sir, for the wonderful question and answer that we had with you. I now invite Dr. Shamla Darvi, freelance educational consultant, to express vote of thanks and to sum up the session. Thank you. Over to you, Dr. Darvi.
Thank you so much, Kavita. And thank you, Mr. Praveen. I must say thank you very much for having so patiently actually presented your views and what happens in the UAE. Thank you so much for it. But of course, listening to you brings back also thoughts about how we do it in India. And I think it's a bit similar, maybe much more structured in UAE because of the KHDA. So let me just summarize what he has been doing and what he did in the past 1 hour. He started off with a video which talked about the education system and how it came up and what it was. And then he talked about how special education started in 2009 and most important passing of the federal law 29 in 2006, which talked about or brought in this whole concept of inclusive education in both the private and the public schools. I think that's a huge step that was taken at that time and which has allowed the situation to be the way it is. He took us through the entire 6 stages or steps of how the whole process of assessment goes through, that is beginning with pre-referral, wherein the students are observed in the classroom and those children who are not doing well are referred to the school support team, and then it gets into the referral, and then it gets into after referral and the assessment. They have a span of 30 days to complete this assessment. They plan either an IEP or an ALP depending on what the needs are. The assessment, the standardized assessment followed have been specified, especially for SLD, both for risk and then for behavior and then for retention for the fine motor. I think he also, yes, I think one very important part which has streamlined or which has structured this entire thing is the involvement of KHDA. I think the KHDA's assessment every year, and I can say that I've been a part of that, and I have been a part of the school when this assessment was going on. So it's really a very intensive kind of an assessment which goes on for 7 days, and they really look at.
Sorry to cut you here.
Yeah,
it's actually a nightmare for teachers.
Yeah, I know. That's what I was just an observer, so I can imagine. But I think that's what makes the difference of the accountability and the ensuring of all the, I'm reading the questions and the ensuring that people do what they're supposed to do. And it's not just about admitting students, but it's also making sure that they get what they need. So though they don't have a thing like an RPWD Act that we have, it says 21 types of disability and these are the concessions. But I think this makes it much more specific, where you look at every case and whatever is needed for the child is given. So irrespective of which board that you belong to, whether it's an IB or IG or CBSC, you're still able to reach out to every student because you believe that every student is an individual and then he needs to be looked at that way. I think that helps. The SEN policy, I think, has also brought in a kind of a cap in the thing of not charging too much. I think that's very essential. Otherwise, we have this thing about, chalo, there is a special kid, so then maybe we can make the most through this, in terms of charging high fees. I think that SEN policy through the KHT has helped to control that. And I think that brings in a lot of uniformity across the UAE in this. And I think finally, the licensing authority, I think it's similar to us that we have this, the CRE, the RCI aspect, where we need to be, they need to be having a license to do it or to practice out there in the UAE. So I think that's it. I think that's very, very nice. I think one difference is the ALP that we talked about. I think a specific plan for gifted and talented. I think that's an important thing. And of course, the cascade of services, I mean, similar to what we also have, I think Dino's cascade, very similar to that, but ensuring that we move from a more generic to then a more specialized homebound, if at all required, but try and make sure that the child is getting everything through a more inclusive setup. So I think that's what I think I've covered all the points that have been shared by Mr. Praveen. Thank you so much, Mr. Praveen, once again from the entire fraternity here. And I think more than 200 participants were a part of this wonderful session or the wonderful workshop that has been organized by HACSC. Thanks once again. And that's all from my side.
So welcome for me here, actually. And thank you for, inviting me to present people here for, just to share my experience, what I've seen all these years.
Yeah.
Yeah.
No, it's been really very, very informative. Thank you, Mr. Praveen.
No worries.
Thank you, Ms. Hudar. I think that's it. Dr. Hudar, I'm done with my.
Yes, thank you, Kavita. Thank you.
Yeah, pleasure.
Thank you, Dr. Darvi, for the wonderful words and inspiring we all. Dear participants, kindly note, now the recording stops. I now invite